Hello, and welcome to an overview of the West Virginia Expanded School Mental Health Framework. In this video, we'll take a closer look at what is Expanded School Mental Health, the history, the current state, and a brief overview of the components. The West Virginia Expanded School Mental Health mini-webinar series covers 12 topics that will help schools and their partners gain a full understanding of the framework and prepare for implementation. This video is the first in our series. I'm Tiffany Pittman, School Mental Health Coordinator from the Marshall University School Health Technical Assistance Center and the Division of Community Health within the School of Medicine. The West Virginia ESMH webinar series is brought to you by the Marshall University School Health Technical Assistance Center with funding provided by the West Virginia Department of Human Services Bureau for Behavioral Health. Our learning objectives are to increase understanding of the West Virginia Expanded School Mental Health Framework and to provide relevant resources. The West Virginia Expanded School Mental Health Framework, ESMH for short, began as an idea in 2006. A small group of professionals recognized the growing need for school mental health services. These professionals, from what are currently named the West Virginia Department of Education Office of Federal Programs, Division of Student Support and Well-Being, the West Virginia Department of Human Services Bureau for Behavioral Health, and the Marshall University School of Medicine Division of Community Health, discussed how to work together to provide a system of mental health supports for students in West Virginia schools. In 2007, these three entities formed the state ESMH steering team in partnership with community mental health, primary care, and other community-based entities. That same year, the work of the steering team was formally approved and made official by a memorandum of agreement signed by the West Virginia Department of Education Superintendent and the Secretary of the West Virginia Department of Human Services, showing a shared commitment to improving school mental health services for all students. In 2008, a school survey was developed evaluating school needs statewide. A core team from the three founding entities visited exemplar sites in other states and further developed the West Virginia model. In 2009, West Virginia was selected as a pilot location for a mental health capacity building project. The core team received 2 days of training and 18 months of technical assistance in developing a school mental health framework. This support helped the core team develop much-needed structure and provided them the tools to develop mission and vision statements, goals, and a work plan. The first ESMH planning grants came out from the West Virginia Department of Human Services Bureau for Behavioral Health in 2009 via funding awards to 7 pilot sites. In 2010, funding grew to 7 grantees across 9 school sites with 2-year planning grants. By 2012, the state moved from planning to implementation grants for 5 grantees across 7 counties and 12 schools. Prior to this expansion, the grant underwent a revision of reported outcomes to better track school, behavioral, and mental health outcomes. In 2014, the West Virginia Department of Education was awarded their first federal Project Aware, Advancing Wellness and Resiliency in Education grant for 3 counties and a total of 9 schools. The ESMH steering team served as advisory board for Project Aware. Between 2017 and 2019, the Bureau for Behavioral Health expanded ESMH implementation grants to 40 school sites across 20 counties with 11 grantees. By 2020, that number had grown again to 46 ESMH school site grants across 20 counties. As the first Project Aware grant ended, West Virginia Department of Education then received a second Project Aware grant covering 3 counties and 9 schools. In 2021, the West Virginia Department of Education received a third Project Aware grant for 3 additional counties and 9 additional schools. At that time, expanded school mental health grants grew once again to support 54 school sites across 20 counties. Let's fast forward to the present, where we see that West Virginia Expanded School Mental Health continues to grow. There are over 90 state grant-funded school sites in 24 counties. 72 of those are Bureau for Behavioral Health ESMH sites, and 18 are West Virginia Department of Education Project Aware sites. In addition, Many schools collaborate to offer ESMH with diversified funding or via various means with no grant funding at all. Expanded school mental health remains a state priority and is written into multiple Department of Human Services state plans and aligns with West Virginia Department of Education policies. The current state ESMH steering team is comprised of about 30 members representing over 20 unique partners statewide. Collaboration is a key to success. Grantees are expected to collaborate with existing community partners to implement a wide range of evidence-based prevention and early intervention programming, as well as intensive supports. ESMH is here to stay. State-level guidance is provided by the Expanded School Mental Health Steering Team. This cross-systems team is co-chaired by the West Virginia Department of Education and the Department of Human Services Bureau for Behavioral Health, facilitated by the Marshall University's School Health Technical Assistance Center. The steering team meets 6 times per year and is comprised of about 30 members representing over 20 partners statewide. Since 2007, the steering team has developed a comprehensive expanded school mental health framework, providing best practice resources to support schools and community providers in effectively integrating a system of mental health supports in schools. Some of the resources developed include educational documents, tools, videos, a website, trainings, conference presentations, and much more. Steering team members remain state and national advocates for school mental health supports. There are many advantages of ESMH. Students are less guarded in their own social context, making schools an ideal space to improve coping and social functioning in their real-world setting. Expected outcomes include improved access to care for students and families, as well as early identification of student needs, improved emotional wellness and a decrease in undesirable behavior, a decrease in days missed from school and work. We find a greater potential to positively impact the learning environment and educational outcomes for students. We also see more effective prevention and early intervention can result in less need for intensive intervention. From a provider point of view, clinical efficiency and productivity are often higher, making this framework more cost-effective than typical outpatient settings. Expanded School Mental Health is a 3-tiered system of student support that builds upon the core services typically offered by schools. It includes prevention, early intervention, and intensive intervention, also known as treatment. The ESMH framework is synonymous with a multi-tiered system of support and predates the West Virginia tiered system of support, which is essentially the same model, but with more focus on academics. So what is Expanded School Mental Health? West Virginia ESMH is a collaborative, multi-tiered framework where schools, families, and community partners work together to improve student mental health supports. This is accomplished by developing a leadership team, establishing a plan based on data, and building upon school strengths using evidence-based programs and available community resources to identify and meet student needs. ESMH is designed to support all students in developing skills that support healthy coping and good mental health, addresses the critical link between academic success and mental health, and is planned and proactive, not reactionary in nature. The framework is strengths-based and flexible, utilizing data to build upon what is working in each school. It is important to note, ESMH is not linear. A student may benefit from all 3 tiers of the intervention at the same time. We'll discuss planning and other aspects of the framework with more detail in our other videos. Now, let's have a quick look at the 3 tiers of ESMH. Tier 1 serves all students and includes universal prevention and promotion of mental wellness. Tier 2 provides early intervention and selective supports for at-risk students who are identified with behavioral, academic, attendance, and social or emotional needs. Tier 3 is our most intensive level of intervention. Services may include clinical mental health therapy and/or intensive interventions that are provided by qualified mental health professionals in a school setting during the school day. In Tier 1, think all students, whole school. Students receive these services in the everyday learning environment, in the classroom or large group settings. Interventions promote mental health wellness and may include social and emotional development, drug and alcohol education, suicide prevention, problem solving, and transition supports. Schools use data analysis to identify needs and priorities. Tier 2, early intervention, is sometimes referred to as selective or indicated intervention. Students demonstrating academic, behavioral, and/or emotional needs receive services in small groups or individually. Interventions include skill building, coping strategies, and supports to address specific needs. Schools identify students with universal screeners and by monitoring student data. Tier 3 is intensive intervention. Schools and community partners provide mental health treatment and intensive supports to students with pervasive behavioral and/or emotional needs. Services include assessment and diagnosis, individual or family therapy, and possibly IEP accommodations. Parents, teachers, and other partners refer students for these services. Students may also self-refer. This level of intervention does require guardian consent for treatment. For a more detailed look into the tiers, check out our other videos in the series. Let's discuss the critical components of ESMH implementation. You'll need a memorandum of agreement. A well-written, detailed, signed legal agreement is essential to avoid misunderstandings, especially in areas where employee turnover may be an issue. Establish an effective leadership team with co-chairs and regular standing meetings to keep your program moving. A good leadership team will establish clearly defined protocols and processes and help maintain collaboration and open communication between all partners. A needs assessment and strategic plan, paired with effective use of data and ongoing technical assistance, will be your best tools for successful implementation. Remember to address secured funding via integration of a multi-year funding plan into your strategic planning and outline your work toward sustainability. The WVESMH.org website has many resources and tools for your convenience, including detailed information about the framework, a 10-step implementation guide, approved evidence programs per tier for grantees, an extensive resources page, and a news and events page where you can see highlights from ESMH and AWARE grant sites as well as upcoming trainings. Of course, we encourage you to check out all of our videos on the Marshall University School Health TA Center YouTube channel. Thanks for joining us for the West Virginia Expanded School Mental Health Framework Overview. Check out our other videos in this series where we explore different components of the West Virginia ESMH framework.